Parenting a dysregulated kid with clinical issues, without clinical issues, is really hard. Today, we're talking about how parents can really unify and best support their child in their diagnosis and treatment. Because honestly, the parents I work with, probably 80% of the time, aren't in synchronicity over this. And in fact, they're really in conflict. And it just adds to what is a perplexing road, a hard road, a really stressful situation. And I want to share my therapist hacks with you so that you and your partner can really unify and get your child really what they need. And so we're going to explore practical strategies that parents can use to best support their child, regardless of diagnosis. But I know how hard it is when it's complex, when it's PANDAS, when there's 5 diagnoses. I call that shopping cart diagnosis syndrome. So let's talk about those all important steps. Number one is that you have to understand the condition together. What I have consistently found is that there's often a quarterback on the team. There's somebody who really is the Google MD. And 9 times out of 10, it's the mom. Sometimes I'm going to tell you when people come to work with me, it's like 0.01%. It's the dad. And you do have to divide and conquer, and we'll talk about that. But when one person is so far ahead in the education of what the clinical issue is and the treatment, and then the other person, you're having conversations about it, they just don't have the background for it, right? It's like when I talk to somebody who tells me a master's degree is just as good as a doctorate, and I laugh in the inside and I was like, really? Because only 5% of the US population has a doctorate for a reason, because it's really hard. And I did a lot more schooling than you. And so my level of knowledge is actually quite greater than yours, despite what you think. Not to diss them, don't diss me. But when I use this analogy because you're asking your partner to be as informed as you, and maybe they're not. So how can you help them to be informed? I mean, of course, number one, when you're working with a provider and you know you're going to stay working with your provider, it is ideal if at least in that intake or one of the major review sessions, like in our one-to-one program, we have this brain map, we do this really long session, and then we have 2 more reviews in our program, right? So most of the time parents join that session, on both parents, and on those sessions. On occasion, especially the first one, the partner's not there. And then all of a sudden the person who's doing the review is like, oh my gosh, they should have been there. So really coming to a session with a provider who's going to be providing long-term care, or even a psychoeducation debriefing, is so important. I say this as having done thousands and thousands of reviews, and really they are reviews, but they really are couples therapy and family therapy a lot of the time. And usually the partner who has not been in charge will say, holy cow, like, I didn't know any of this. And it really creates a beautiful shift. So getting to a key doctor appointment, we're reviewing labs, we're meeting with somebody that, the quarterback feels, wow, this is really instrumental, is so important, right? The other part is that, you want to discuss the basics, right? We can't just assume that your partner knows everything. So how can you give them the basics, right? So sharing a podcast episode that I did, of course, Dr. Rose, your authority, giving them one of my blogs, like giving them information that you have already validated that feels right for you and your family, so that you don't say, just Google it. Because you just Google things, you're going to get cuckoos, especially now with all this upset in Google. Google, don't downrank my video because I said that. So, but you want to make sure you're sharing resources that are the basics, the symptoms, what to do, and, that talk about causes, that talk about treatments to help educate. And ideally, again, you have somebody who is on your team and your provider. Now, if you're looking for help, we have our dysregulation solution, and it's a program that has lots of information, and an AI infused program. And and it guides you to the right solution for dysregulation, but also it's just super accessible. It's really like a database that you just ask questions and it pulls up videos exactly to the seconds of where I said things. So you don't have to watch everything, which is pretty cool. And I made it for overwhelmed parents. You can go to drroseann.com/help, and that's our solution matcher, and it's going to guide you. There's lots of other resources. Please don't be overwhelmed. The solution matcher is designed to cut through the overwhelm and guide you to the right solutions. But you want to give your partner access to accurate information. Don't underestimate the power of that. I just can't even tell you how much when people come to me, they're in shock of what they didn't know, right? You don't know what you don't know. And when you do know, you can do better. Number two, you want to have a unified front. So you want to be as consistent as possible in front of your kid. You don't want to really have blowups in front of them. You want to model teamwork as much as possible. It doesn't mean that you can't disagree, because parents do disagree. You just don't want to get into heated arguments on the regular in front of your child. It's only going to add to the dysregulation, right? You want to develop similar verbiage when you talk about the clinical issues, when you talk about the treatment. It gives a sense of safety to your child. And it also helps reduce confusion and increase learning. Geez, when you're dysregulated, you're just not processing information in the way that you really should be processing information. So constancy of language is really helpful. My next tip is to divide responsibilities. So you can't do everything. If you try to do everything like my moms often do, no offense, dads, you're often working extra to pay for things. I get it. But if you're trying to do everything, you're both going to get burnt out. And also, you're going to be pissed off at each other, because if one person is the quarterback on all the information, all the knowledge, all the treatment, you're already spinning and having a hard time knowing what your next step is. And then you and your partner are in disagreement because you're pissed at them because they don't know. Well, they don't know what they don't know. And you do have to divide and conquer, but you have to have that shared responsibility of the knowledge so that you can make informed decisions. I think that's important. My next tip is communication is key, right? So when we're irritated, when we're frustrated, communication can break down. You can be great parents and disagree, but you have to find a way to make it work where you can be a parenting team. What are ways to improve communication? So number one, you want to schedule check-ins where you're actually finding time to talk about this. It doesn't have to be 3 hours. It could be 10 minutes. Like, hey, let's just do a debrief, on what we're seeing behaviorally, what treatment is like. Maybe you're doing it once a week or every other week. I would put some frequency in it so that it's very clear this is important, because it's a lot better than spending an hour yelling at each other or, being irritated. Therapists speak, we talk about practicing active listening. So you want to actually listen to your partner without interrupting, right? So when one person has more knowledge than the other, person can feel dumb. They can feel more frightened by the information. They can feel shameful. There's a lot of emotions that can come into that. So being empathetic, listening, validating are all important skills in any marriage. But you really need this when your child is having a hard time. I also am a big fan of shared calendars. So appointments that you have are really clear. There's no miscommunication. You also raise the red flag if you are the quarterback and you need help. Again, dividing and conquering responsibilities are helpful, but sometimes we can get overwhelmed, and it's okay to say that, right? When you really can't find a way to communicate properly, maybe you're married, maybe you're not married. Find a lot of my divorced couples actually have figured out ways to communicate better, not being married. Not always, but there are lots of stages in relationships. And no matter what, you are tied to this child, and this is scary. And you're both scared, and people act differently when they're scared. They don't always act the way you think, right? Maybe you're the tough one. Maybe you're the crier. Maybe that your partner's agitated. These are all ways that we express our fears. And there's nothing more scary than seeing your child struggle with complex behavioral issues, PANDAS. all these things have such uncertainties behind them because it's so hard to find expert care. And so when you are struggling as a couple, I do really recommend some couples therapy. If you are really at disagreements, you're at each other's throats, you're at a constant discord, you're considering divorce. I mean, special needs parents have a divorce rate of over 80%. The divorce rate in America is over 60%. I am a hopeless romantic. I'm married 30 years, and life is hard sometimes. And you need to find ways to communicate and reconnect to get over it. And your kids need you. And I know there's lots of things in that, but sometimes professional help, I've seen it time and time again, can really make a difference. Couples therapy is about teaching communication. It's not about blaming each other. Just remember that. Couples therapists should be sainted. It's really hard. My next tip is always involving your child in the communication in a developmentally appropriate way, right? So talk to them about their diagnosis. They are well aware something's going on, people. Talk to them about treatment and include them in the decision-making process whenever it's developmentally appropriate, right? Sometimes kids resist treatments because they've been, you know, kind of forced or pushed in a certain way and there's no discussion on it. So then what do kids do when things feel out of control? They try to grab control any way they can. So good communication is really important. And then just know that parenting is not about perfection, right? It's about working through challenges. And there is nothing harder than when you're trying to support your child's needs. And I hope these tips and better understanding, understanding the condition, finding ways to divide and conquer, communicate, and involving your child. I hope this really got you thinking differently about what you're doing and maybe not what you should be doing more of. And again, if you're looking for more support, that's what I'm here for. And I've been doing it for 3 decades. Privilege of helping many, many people with complex issues right from the early 90s. Dr. Rowe, that was her specialty. And I work with a lot of families with PANDAS, and OCD. You can go to drroseann.com/help and take that solution matcher. And that's the path to helping your child and family find ways to regulate their nervous system.